Hello future nurses, welcome to this video. This time we're going to talk about nurses charting, a step-by-step tutorial. These are the topics that you will learn throughout this video: transcribing, clinical handover, preparing medications, IV fluids monitoring, plotting of vital signs and the intake and output, and creating nurses' notes. The purpose of charting. It is to track the progress of the patient's condition during the hospitalization as well as the status upon discharge. It also serves as an information sheet of the medications and procedures rendered to the patient. Now let's talk about transcribing a medical order.
What is a medical order? A medical order is an order that may be written or verbal made by the physician pertaining to care and management. To transcribe means to write down or copy. What do you do when you carry out an order? First is to transcribe the medical order to the nursing cardex. Second is to fill up the medication sheet or the medication administration sheet, or as we call it, the MAR, and also fill up the appropriate forms for laboratory and diagnostic requests. Here are the sample forms of the nursing cardex, the medication administration record, as well as the doctor's order sheet. In the upper left portion is where we will transcribe the client's medications. In the upper right portion is where we will transcribe the patient's treatment as well as the management. On the lower left side is where we will transcribe the client's laboratories, and in the lower right side is where we will input the client's parenteral, infusions, as well as transfusions. In the medication administration record, we have to first fill up the client's demographic data in the upper portion of the sheet, and then fill up the dates in the upper portion of the table, and transcribe the client's medications on the left portion of the table. In transcribing a medication order, we have to make sure that the 8 rights are there in the doctor's order. These are: first, the right patient. One patient should be equals to one cardex only. Second is the right medication. Third is the right dose. Fourth is the right route. Fifth is the right time. And sixth is the right documentation. Seventh is the right reason. And lastly, eighth is the right response. The correct way of transcribing an order is to first read every word on the doctor's order sheet. Second is when the medicine is received from the pharmacy, check to make it sure that it is the correct medication. Third is to write each word on the MAR or the medication administration record that is on the medication label. Fourth is to recheck your transcription word for word to make sure that it was transcribed correctly.
Now let's learn about clinical handover or endorsement.
Clinical handover. Clinical handover is the transfer of professional responsibility and accountability for some or all aspects of care for a patient or group of patients to another person or professional group on a temporary or permanent basis. During clinical handover, we must follow the ISBAR method. ISBAR method stands for Introduction, Situation, background, assessment, and recommendation. In doing your clinical handover, you should always start with the nurse's prayer. After saying the prayer, you can now proceed to endorsing the patients in the ward. You must start by indicating the census or the number of patients in the department. First, you must start with the introduction. State your name, role or position, ward unit, and the patient's information. Next, situation. State the problems, symptoms, and if the patient is stable or unstable. Then the background. State the diagnosis, previous history or symptoms, relevant history or comorbidities, medications and allergies, and reason for the patient to be admitted to the hospital. Then the assessment. State the vital signs and trend, assessment, clinical signs supporting the diagnosis or indicating the severity, planned procedures, treatment and results, and patient or carer understanding of the treatment plan. Lastly, recommendation. Recommendation for ongoing care with clear time frames that identify what will happen next, the plan, any risk to the plan, and a contingency plan. Then, the confirmation that handover and transfer of accountability and responsibility has been accepted.
Now let's move on to preparing medications.
Medication ticket. What is the objective of giving a medication ticket? The objective is to guide the nurse to follow the doctor's written order, the indication of the drug to be given, the frequency of doses, the amount of each dose, and the method of administration. So a medication ticket must include the name of the patient, the age if necessary, the room number, the date, the name of the drug to be given, the route, time and frequency, the doses, and the nurse's on duty signature. What are the colors of the medication tickets? So we have 6 colors for the medication tickets, and these are the yellow, white, pink, green, blue, and red. A yellow ticket is given BID or twice a day, and the timing is 8 a.m. and 6 p.m. A white ticket is for OD or once a day, also for every 6 hours, for every 8 hours, every 12 hours, and every 24 hours. And the timing is free timing, meaning it can be given any time of the day as long as it is within that day. Pink ticket is for TID or thrice a day, and the timing is 8 a.m., 1 p.m., and 6 p.m. A green medication ticket is given QID, meaning or 4 times a day, and its timing is 8 a.m., 12 noon, 4 p.m., and 8 p.m. And a blue medication ticket is Q4 or every 4 hours. We can have 8 a.m., 12 noon, 4 p.m., and 8 p.m. And lastly, a red medication ticket is for PRN or as needed medications. So what is the difference between OD and Q24 hours? OD is free timing and Q24R is same time. For example, the medication is given today at 10 a.m. and tomorrow it will be given again at 10 a.m. and the other day 10 a.m. again, so on and so forth.
Medication errors. Medication errors are unattended mistakes in prescribing, dispensing, and administration of a medicine that could cause harm to a patient. Medication errors can occur at all stages of the medication administration process. There are 4 main types of medication errors that occur with hospitalized patients. First, we have the prescription errors, for example, wrong drug or dose. Second, transcription or interpretation error. These include misinterpretation of abbreviation. Third, preparation errors. The example are calculation error. Fourth, administration error. For example, wrong dose, wrong time, omission, or additional dose.
Most medication errors occur during the administration stage.
There are 10 rights of drug administration. First is the right drug. The first right of drug administration is to check and verify if it's the right name and form. Be aware of look-alike and sound-alike medication names. Second is the right patient. Ask the name of the client and check his or her ID band before giving the medication. Even if you know that patient's name, you still need to ask just to verify. Third is the right dose. Check the medication sheet and the doctor's order before medicating. Be aware of the difference between an adult and a pediatric dose. Fourth is the right route. Check the order if it's oral, intravenous, subcutaneous, and intramuscular. Fifth is the right time and frequency. Check the order for when it would be given and when was the last time it was given. Sixth is the right documentation. Make sure to write the time and any remarks on the chart correctly. Seventh is the right history and assessment. Secure a copy of the client's history to drug interactions and allergies. 8 is the drug approach and right to refuse. Give the client enough autonomy to refuse the medication after thoroughly explaining the effects. Right drug interaction and evaluation. Review any medications previously given or the diet of the patient that can yield a bad interaction to the drug to be given. Check also the expiry date of the medication being given. Right education and information. Provide enough knowledge to the patient of what drug he or she would be taking and what are the expected therapeutic and side effects.
A medication is a substance administered for the diagnosis, cure, treatment, or relief of a symptom or for prevention of disease. Drugs can be administered for these purposes. Number 1, diagnostic purposes, to identify any disease. Number 2, for prophylaxis, to prevent the disease, such as heparin, to prevent thrombosis, and antibiotics to prevent infection. Number 3, therapeutic purposes, to cure the disease. Medications are available in a variety of forms. The form of the medication determines its route of administration. Drug forms can be an ampule, a tablet, a capsule, lozenge, a solution, an insulin pen, nebulizers, metered dose inhaler, and suppository. This is an example on how to prepare an IV-TT medication.
Now let's move on to IV fluids monitoring.
When you received a new order, do not forget to fill up the IV tag, which is taped at the IV bottle. For the IV tag, fill up the patient's name, room or bed number, fluid infusion, medication or additives, flow rate, bottle number, time started, duration of infusion, and time due. Note: do not forget to put on your name stamp with your signature. After confirming the doctor's order and after inserting the IV fluid infusion, we can now note it in the intravenous fluid monitoring sheet. Fill up the patient's name, age, attending physician, sex, civil status, room number or bed number, and hospital number. Then, fill up the date the IV is ordered, the amount ordered, flow rate, the time started, which site the IV is inserted, and the infusion. Take note of the time it will be finished, the amount absorbed, the bottle number, the amount left, and the date it is consumed, which is signed by the nurse on duty. Time taping. The use of time taping an IV helps ensure that an IV solution is being infused at the prescribed rate. It also helps facilitate calculation of fluid intake. Suppose the doctor ordered PLR 1 liter at 30 drops per minute at 9 a.m. So there will be 120 ml per hour to be absorbed. At 9 a.m., the IV infusion is at 1000 ml. At 10 a.m., there will be 880 ml left. At 11 a.m., there will be 760 ml left. At 12 noon, there will be 640 ml left. At 1 p.m., there will be 520 ml left. At 2 p.m., there will be 400 ml left. At 3 p.m., there will be 280 ml left. At 4 p.m., there will be 160 ml left. At 5 p.m., there will be 40 ml left.
Now here's for plotting vital signs and INO.
First is you have to fill up the headings. For the name, you have to put the family name and then the first name. And then the age, room number or bed number, and the attending physician. So next is you have to put the date. Next is the time that you get the vital signs. It depends if your patient is Q1 or Q4 for the vital signs. So if it's Q4, you only have to put 8 a.m. and 12. So next is the patient's blood pressure. Next is the PR or the pulse rate, the respiratory rate, and the temperature. You have to put the mental status of your patient. It depends on what is the status of your patient as you enter the room during taking of vital signs. And you can also indicate the O2 saturation in this side. So next is put your stamp and your signature after. Pulse and respiration rate chart, you also have to fill up the headings. And then the days of the hospitalization of the patient, so day 1, day 2, day 3, day 4, and day 5. If the patient comes from the OR or the operation room, you also have to put the days of the post-operative operation of the patient, and then don't forget the date. So 3, 21, 22, and so on. So first is the temperature. So we already have a temperature for the 4 a.m. and our time is during the 8 a.m. So our temperature is 36.5. During the 4 a.m. it is 37. So we have to go down. This is 36.5 and then connect the dots. So you always have to use black ball pen when you have to chart the temperature. For the blood pressure, you have to put it in this box. During the time stool and urine, you have to plot in 6 to 2 since our shift is from 6 to 2. So you have to ask the patient if how many times did he defecate or urinate at the end of the shift. So your ball pen depends on the shift. Since we are from 6 to 2 a.m. shift, we have to use black ball pen. So the patient defecated once from 6 to 2 and he urinates thrice from 6 to 2.
Here we have a fluid intake and output monitoring record. This is what it looks like. Here we have the name of the patient, age, attending physician, sex, civil status, room number or bed number, and as well as the hospital number. So we will use the black ball pen. Also, we will use black pen for the AM shift. So for instance, let's have patient CD, a 30-year-old male patient, single, under the care of Dr. Imperial, in the ICCU 1, and the hospital number is 156861. Now, we can see the date when you assess the intake and output of the patient, the time of your shift or the time you took the intake and output, the parenteral intake of the patient, which include the IV fluid, the oral intake including water, juice, or even soup ingested by the patient, and then the others, and then the total volume of intake. Now, let's proceed to the output section. Here we can see the urine output of the patient in ml, drainage if the patient is attached to a drainage bag, and then others, and total urine volume. Let's try plotting the fluid intake and output of the patient. The scenario is that I am tasked to take the INO of the patient Q 4 hours. Let's write the date today, March 22, 2022. The time is 6 a.m. to 10 a.m. So the patient is infused with plain NSS 1 liter at 20 drops per minute, infusing well at left arm. When I check the IV of the patient, he has consumed 160 ml. When I asked the patient about the estimated water he consumed during 6 a.m. to 10 a.m., he reported intake of 100 ml. In others, we will leave it blank since there is no additional liquid or IVTT medication consumed by the patient. Now, let's add the parenteral intake, which is 160 ml, plus the oral intake, which is 100 ml, equals to 260 ml, and place it in the total column. Now let's move to the urine output of the patient. When the patient was asked about the estimated urine output, he reported 200 ml. There is no drainage output, no other additional output. So we will write here in the total column 200 ml. Since we have to take the INO every 4 hours, let's go back to the patient at 10 a.m. until 2 p.m., our end of shift, and assess the intake and output again. The IV consumed is 160 ml, oral intake is 130 ml, again no other additional intake, so 160 plus 130 is equals to 290 ml. While the urine output is 100 ml, no drainage and no additional output, the total is only 100 ml. So since it's time for our end of shift, we have to add up all the intake and output of the patient that we gathered throughout our shift. So from 6 a.m. to 10 a.m., it's 260 plus from 10 a.m. to 2 p.m. it's 290. The total is 550 ml. While the urine output from 6 a.m. to 10 a.m. is 200 ml plus the urine output from 10 a.m. to 2 p.m. is 100 ml, the total is 300 ml. Let's remember that the intake of the patient must be higher than the output of the patient. It's because our body may also have a hard time getting rid of fluids. As a result, excess fluid builds up in the body. This is called fluid overload or volume overload. This can lead to edema or excess fluid in the skin and tissues. And that's it. I hope you learned how to get and plot the intake and output of the patient in the monitoring sheet.
Now let's learn about creating nurse's notes or FDAR.
How to write FDAR or nurse's notes. The sheet includes the name, age, attending physician, sex, civil status, room number or bed number, and then the hospital number. The sheet includes 5 columns: the date, the shift, focus, and then the time and the DAR, data, action, or response. So there are 3 colors that we utilize in writing the chart for different shifts. I'm gonna use the black pen because my example is AM shift. So first, you have to write the date and then your shift, 6 to 2. And then you write the focus. So the first focus should be receiving assessment. So in every FDAR, you have to begin with the receiving assessment. And then the time where you receive the patient. And then first, you need to start with the data. The data for receiving assessment is how you observe the patient by the time you have seen your patient or during the time you have received your patient in your area. After the data for the receiving assessment, if there is a line or space, you have to write a linear or straight line so that no one can insert what you have written. And then you have to write another data for the focus of your FDAR. The data for your focus should be connected. After the data, you write the action that you have performed or the interventions you have performed in your patient, focusing on the focus you have written in the nurse's notes. So there should be the interventions where you focus on the problem of your patient. So after the action, you have to write the response of the patient. The response should be on how you have intervened your patient. The response should be on how the patient understands or how the patient reacts to the interventions given. And then the last focus is the end of shift. So you have to write another data for the end of shift or the assessment that you have observed during the time you have ended your shift. You have to write your name or put a stamp for legality purposes and to know that it is you who have written the note. That's it for FDAR.